The member from Sarnia-Lambton.
Thank you, Mr. Speaker. My question is to the Minister of Health. Minister, a few months ago, a long-time resident of Sarnia-Lambton, an Alistair McCabe, needed an ultrasound-guided needle biopsy in order to confirm whether or not he had cancer. He was told that the procedure could be done immediately at St. Joe's Healthcare in London, but the hospital refused to see him, told him he needed to seek treatment at a hospital in his own area. In other words, his own local health integration network. Sarnia and London, for the Minister's information, are not in the same LHIN, and the procedure needed was not quickly available in his home LHIN. Minister, we all know that with cancer, earlier detection is a better chance of survival. Unfortunately, Mr. McCabe has since passed away. Minister, is it now government policy that patients can only receive treatment at hospitals within the boundaries of the LHIN they reside in?
Minister.
Speaker, I want to thank the member for the question. I certainly can't speak to the specifics of the case, but I can tell you that local health integration networks are part of our government's plan to transform the healthcare system in order to make it more patient-centered, efficient and accountable. They serve all Ontarians. Our healthcare system has no borders and no boundaries. For example, a woman from Sudbury or from Sarnia should be able to get care in Ottawa or in London, and a man in Ottawa should be able to get care in Sarnia or Sudbury. The goal of local health integration networks, community-based care, reflecting the needs of the community, planned, coordinated and funded, but in an integrated manner. Building a healthcare system, Speaker, around the needs of patients and communities, but ultimately they serve all Ontarians. I've answered the member's question directly. There are no borders and no boundaries when it comes to patient care in the province.
Supplementary.
Minister, St. Joe's Health in London has admitted in writing to the McCabe family that patients are, in fact, to seek treatment in the LHIN in which they reside. Repatriation does in fact exist. In some cases, those treatments or procedures are not available closer to home, leaving these patients with little choice. This case falls on the heels of London Health Sciences refusing to take patients from Sarnia altogether unless they are near death, Mr. Speaker. Minister, you should admit the LHINs are a disaster. Hospitals clearly think geographic boundaries do exist when it comes to health care delivery. Instead of coordinating services, the LHINs are causing confusion, which is resulting in fatal consequences for patients. Will you act to fix the problems with the LHINs that do exist?
Minister.
Speaker, thank you very much. As I said, there are no borders and there are no boundaries. We have a permeable system across the province where people can be able to experience the kind of care and the kind of support they need. I want to quote Gary Switzer, the CEO of the Erie St. Clair Local Health Integration Network. And he says, and I quote, "What we really want is the best access for care in a timely fashion. If a procedure is available somewhere else, we need to get that point across to the referring physician." Ron Gantner of the Erie St. Clair LHIN said there are no policies that would have caused the hospital to refuse care to someone from outside the LHIN. He says, and I quote, "We're supposed to be seamless, borderless healthcare system. We're not trying to put up fences around care, and in fact, Speaker, we don't. We encourage quick, seamless, and the efficient delivery of care for anyone, anywhere in the province." Speaker, that's what LHINs are doing. That's what hospitals.
Thank you.